I'm so glad that I'm able to congratulate Welfare at the Norwegian University of Science and Technology, NTNU, on becoming a WHO collaborating center on well-being and social sustainability digitally. This is, of course, an important academic milestone, also for Norway. For a small country like Norway, the World Health Organization is essential. It enables us to shape global health policies, strengthen our preparedness for health crises, and amplify our voice through multilateral cooperation. And by supporting WHO, we both safeguard our own population and contribute to global health, security, and equity. In a challenging research situation, WHO collaborating centers play an increasingly important role in supporting WHO's normative work. As a WHO collaborating center, Welfare can contribute to translating global WHO agendas into national policy context and implementation, and help bridge research, policy, and practice. And this is valuable for public authorities. The research at your center concentrates on themes like well-being, health equity, social participation, and the importance of mattering. And these themes are deeply embedded in Norwegian society and reflected across our policy frameworks, from our constitution to our current national public health goals. Norwegian public health policy and our Public Health Act is built on the principle that a good life is created mainly outside of the healthcare sector, where we live and where we work, through meaningful activities and, importantly, through our social relationships. I am confident that research on these topics will become even more important in the years ahead, when facing increased pressure on public services and our welfare state, along with persisting and in some areas rising social inequality, climate change, and global turmoil. In such times, it is important to be reminded of what matters for our well-being and for our health, and thus the resilience of our society, so that we can continue to protect and enhance these values. National health authorities have benefited from knowledge contributions from research at Welfare NTNU over several years. For instance, you contributed to bring forward important knowledge about social inequalities in health in Norway through the Marmot Review from 2023, together with University College London. And this review helped inform the current National White Paper for Public Health Policy. And in a few weeks' time, you will launch a report that explores what value a well-being economy approach could have in a Norwegian context. That report will be the result from a collaborating project initiated by the Norwegian Directorate of Health. And the findings from the project will feed into the biggest joint action on public health from the European Union, called Joint Action Prevent NCD. We look forward to the launch of this report, which will take place during a seminar about the national work with well-being on the 4th of June, hosted by the Ministry of Health and Care Services and the Directorate of Health. And we hope to see many of you there as well. The report that will be launched in June is a contribution to the national work with well-being in Norway that has been ongoing for over a decade. The Directorate of Health has coordinated this work along with several close collaborating partners, many of you who are here today. One outcome of this work has been the development of a system for measuring well-being, which Statistic Norway and the Norwegian Institute of Public Health have used to conduct national and regional surveys of well-being in the adult population since 2020. And the findings reveal clear social inequalities in well-being. People outside the labor market, people with health problems, and those who are single or non-heterosexual are among the groups more likely to experience low levels of well-being. In 2025, the Norwegian government presented a national well-being strategy from measurements to policymaking, reflecting a shared question in many countries: how well-being insights can inform policy. And the reflections from this launch seminar will be relevant to further work in Norway. In conclusion, I really look forward to continued dialogue between research, policy, and practice, nationally and internationally, and on how we can promote well-being, participation, and fairness in this changing world that we are living in. And I would once again congratulate Welfare and NTNU on this important recognition and wish you every success in the work ahead. Thank you.